First, if you suspect you have a food allergy, I would definitely recommend seeing a board-certified allergist. To diagnose a food allergy, first an allergist reviews the patient's medical history. Based on that history, we can decide to do one of three things: a skin prick test, a blood test, or an oral food challenge. We often do a combination of these three things to get multiple data points to help us find an answer. To do a skin prick test, also known as a scratch test, we prick the common allergenic proteins in a liquid form through the top layer of the patient's skin. If the patient is sensitive to one of the allergens, they'll form a small bump like a mosquito bite. Reacting to a skin prick test means they are sensitized to that protein, but not necessarily allergic. We'll often combine a skin prick test with a blood test that measures allergy antibodies called IgE antibodies to get a better sense of the patient's risk of allergy. The gold standard for diagnosing a food allergy is an oral food challenge, which is where the patient eats a certain food in a very controlled environment with the allergist present. From there, we determine the likelihood and severity of the allergy and what steps to take to address it.